Arizona has long had high rates of skin cancer, which is not surprising considering the abundance of sunny days in the desert Southwest. But what do we know about skin cancer? Its risk factors, how it's diagnosed, and the best ways to protect against the disease. To get some answers, we welcome Dr. Staren from Arizona Oncology. Welcome to the show.
It's my pleasure.
You know, we do a lot of things on skin cancer over the years, and it's almost like watching your kids around water. It's the same thing. You got to be careful out there, don't you?
You do. And skin cancer is important to recognize, and there are a number of things that we can talk about as to help us recognize what the risk factors are and how to avoid it. But it's important to know that in Arizona, where we have large amounts of sun exposure, that because of ultraviolet radiation, we have an increased risk. But it's not just ultraviolet from the sun. Tanning booths, sun lamps, and the like also can increase the risk of both the different types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and of course melanoma.
Okay, talk about those three and the differences.
Basal cell carcinoma is the most common, followed by squamous cell carcinoma and melanoma. We have two layers of skin. We have the outer epidermis and we have a dermis, and that epidermis has three cell types: the squamous cells at the top, the basal cells at the base or bottom, and then cells that have melanin or pigment, the melanocytes. And it's from those cells that we develop, respectively, basal cell carcinoma, squamous cell carcinoma, and melanoma. The good news about squamous cell carcinoma and basal cell carcinomas is that they rarely metastasize. Squamous cells slightly more than the basal cell carcinomas. Basal cell carcinoma is very common. In fact, nearly 4 million cases can be expected per year in the United States.
Wow.
Squamous cell carcinoma, about 2 million cases per year. Melanoma is the most aggressive and the one that we certainly have the most concern about, and there's about 100,000 cases per year.
Risk factors involved. How much is genetics playing a factor here?
It is important. One of the things we pay attention to is family history or personal history of a skin cancer. But there are certain skin types. The classic fair-skinned individual with blue eyes, green eyes, freckles, blonde hair, red hair, etc. But knowing that your family has a history or you have a personal history, you certainly need to pay attention to that. We do know that there's certain genetic markers that predispose to it, but without question, the family history is important.
And I've read that darker-skinned folks, sometimes it's more serious because you don't catch it as quickly. True?
And it is true. In fact, the incidence of carcinoma in dark-skinned individuals is about 1/20th. But nonetheless, they can develop melanoma or other skin cancers, and they develop in areas that we wouldn't think of, underneath the fingernails, on the palms of the hand or soles of the feet. And there is squamous cells within various areas of the body, the esophagus, the anus, etc. So they can develop skin cancer.
Okay, let's talk about diagnosis. I know there's an ABCDE rule or something along those lines. Give us that.
Well, when we talk about A, it's asymmetry. So irregular areas, nodularity to the lesion, borders, irregular or jagged borders we pay attention to. So rather than a round mole, something that has irregular edges to it. C is the color. When you start to see a dark lesion or something that's changed in color, you need to pay attention to that. The diameter, larger than about the size of a pea. When it gets bigger than that, certainly we pay attention. And lastly, evolving. Something changing in color, changing in size, changing in shape is important.
With that, and we talked about risk factors. Those who have had breast cancer, talk about that connection.
Well, there is a connection because they're both epidermis. The breast is the ducts, and the melanoma or various skin cancers. Certain risk factors correlate between the two. But the fact of the matter is that we see increasing incidence of both of those cancers, and the relationship as to why they're both increasing is a little bit unclear. It is true, however, that there are certain medications that have been taken, supplements and the like, that are thought to decrease the incidence of those cancers, one of which is vitamin D.
Yeah, but vitamin D, you get that from the sun. So how do you work that out?
Well, it ends up being one versus a supplement versus one that's taken through the sun. And the truth of the matter is that that relationship is still somewhat questionable. But given the choice, take it as a supplement rather than counting on the sun to provide it.
The importance, I know, getting screening. Let's talk about screening.
Sure.
How often should people be screened? age differences, skin differences? How?
Well, the biggest risk factor is those that end up having a previous history themselves or a family history. Then there are certain lesions, atypical nevi, atypical moles, if you will, that end up increasing the risk. A type of lesion called an actinic keratosis increases the risk. So individuals with that family or personal history should be screened, total body evaluation on at least a yearly basis. That's the best way, because we know that if you detect melanoma, as an example, early, it gives us the best chance for cure.
But again, the treatment is still evolving as well. Immunotherapy, is that involved here at all?
Well, this is one bit of good news. When I started out in medicine, really, we just didn't have great therapies. We started in immunotherapy and we had a few chemotherapies, but none of them worked very well. Over the last few years, we've identified targeted therapies, and we now have patients, even with metastatic disease, that have been cured from melanoma, and that's such a change. So there's hopefulness, and I think that we'll improve our treatments. But at the end of the day, avoidance ends up being the best. When you are needing to be out in the sun, wear a hat, wide brim, cover up exposed areas with clothes that go all the way to your wrists. Use sunblock. Even an SPF 15 decreases the incidence of melanoma by 50%.
Interesting.
So those are the things. Be cautious, particularly in the beautiful area that we have with lots of sun exposure.
Yeah, Dr. Staren, this is great information. It's good to have you here. Thank you so much for joining us.
It's my privilege. Thank you.
And that is it for now. I'm Ted Simons. Thank you for joining us. You have a great evening.